Currently, we have tools that are somewhat crude. They have difficulty getting into contralateral spaces or places that we can't see straight on. And very importantly, the current tools create damage to the end plates, which create bleeding, subsidence risk for the cages. So there are numerous issues with the current tools that we have at our disposal. And there have been a variety of alternative tools that have been created, but really have not done a very good job until now. The Dreal technology is really very well set up to optimize our posterior interbody preparation for discectomy and fusion. The advantage of Dreal is that it allows for two very important things. One, it allows us to reach all of those spaces that are hard to get to with standard tools. And the way that it debrides is both rapid and efficient, but also very safe. So it doesn't violate the end plate like typical tools. Posterior interbody minimally invasive fusion work is starting to escalate in its prevalence in the market. And so we need better tools to do a good job in that setting, even more so than the open techniques. So having a tool like Dreal that's both efficient and more effective at the discectomy, but also safer for the end plates, is really a well-needed, long anticipated desire for most surgeons that are doing posterior interbody work, and that's particularly true in the minimally invasive space.
I think one of the biggest problems with posterior interbody fusions, either TLIF or PLIF, is end plate preparation. And everybody's really confident they've done a really good job cleaning off the cartilage end plate down to subchondral bone. But the truth is, it's really a very poor preparation, particularly compared to an anterior interbody fusion or any oblique fusions or lateral fusions, where we actually see the end plates directly all the way across. So we actually did a cadaver study where we did a TLIF and one level, and I was very confident that I did a really nice, meticulous job preparing the end plate with the curettes. And then we put our endoscope down to take a look at it, and it was shocking how bad it was. So then we then dissected the specimens and actually opened them up to take a more specific look at them in full. And it was clear that the Dreal preparation was far superior to the curette preparation.